I'll get us kicked off here. All right. Good morning, good afternoon, everyone, depending on what part of the world you're joining us from. Thank you for joining us again for our Division 18 VA section special webinar series on psychologists as agents of change. Again, for those of you that haven't been joining us for this series, this is a three-part series. We had an opportunity to begin this series on advocacy last month, and this month we are very excited to be able to bring you Dr. April Alexander, who's going to focus in our conversation on increasing the field's impact on social justice. So in a minute, I'll introduce Dr. Alexander and hand the floor to her to begin her presentation. But for now, I'm going to go ahead and hand it over to our chair for our education committee, Dr. Jeremy Sines, who's going to do some housekeeping issues and talk to you about CE credits and certificates and all that fun stuff, and then we'll get started. So Jeremy, thanks for joining.
Yeah, of course. So just going to go over a couple of different things. So the Division 18 VA section officers and committee members who are here are not hosting or speaking as representatives of employees of the Veterans Health Administration in any shape or form, nor do they speak on behalf of the Veterans Health Administration. The VA section values diversity, equity, and inclusion. We ask that participants and hosts maintain an environment of respect and professional discussion throughout the webinar. The VA section does not tolerate disrespectful language or behavior, psychological or verbal abuse during webinars. Individuals engaging in any of the above may be removed from the webinar. Complaints or concerns regarding the removal may be discussed with the Division 18 VA section chair, VA div18 at outlook.com. All of this is being pasted into your chat if you have any questions or you need to look up the email. All of our webinars are recorded. Recordings can be found on our Division 18 VA section YouTube channel, which is pretty immediate, and Division 18 VA section webinar webpage, which takes a little bit of time to load, but that's also where you'll be finding the slides from this presentation in addition to the recording. So questions for presenters. If you do have any questions, we ask that you use the Q&A feature so that we can keep track of the questions and make sure that they're addressed. Unfortunately, we may not be able to answer all questions, and there may not be time to answer all questions in this webinar, as presenters may need to expand on subjects or certain questions may need to be expanded upon. As far as Cs go, which is why many of us are here in addition to this wonderful and exciting topic. So if you are using the Zoom link that was provided to you at registration, this produces an attendance report, so there's no need to tell us that you attended. So for Division 18 members, you do receive free CE as part of the benefits of being members of Division 18 for today's webinar. You must attend at least 45 minutes of the presentation in order to obtain that CE. For Division 18 members, if you are calling in non-Zoom, so you are using a telephone number that is not in the registration or your Zoom reminder, please make sure to email the Education and Training Committee. The address is pasted into the chat. To verify your attendance, we'll be needing the telephone number that you used, as well as your name, so that we can verify your attendance with our attendance report. As far as non-Division 18 members, the CE fee is $15, which needed to be paid prior to this webinar. Refunds are not provided, and payments cannot be made after the webinar. If you have paid, you're a non-Division 18 member, as long as you attend 45 minutes, we'll be able to get you the CE. Same thing, if you're using a telephone number, please make sure to email us to verify the telephone number used and your name. You will be sent a survey link to provide feedback regarding this webinar and our services. It's completely optional and anonymous. You do not need to fill it out to obtain a CE certificate. Please allow up to 4 to 6 weeks to obtain your CE certificate. If you do not hear from us within 4 to 6 weeks, please make sure to email us at the Division 18 VA section webinar committee at outlook.com.
All right. Thanks, Jeremy, for all that important information. Well, without further delay, I'm going to go ahead and introduce our wonderful speaker, Dr. April Alexander. Again, today, the focus of the webinar is increasing the field's impact on social justice. So really focusing in on the fact that recent national and global issues have pushed psychologists and psychology trainees to find new spaces to engage in both advocacy and activism. So the aim of our presentation today is to discuss how we can increase student, trainee, and psychologist involvement in advocacy, public scholarship, and social justice efforts. So it's my pleasure to bring to you Dr. April Alexander, who is the Metrolian Medical Foundation Distinguished Scholar in Health and Public Policy at UNC Charlotte. She received her doctoral degree from Florida Institute of Technology with concentrations in forensic psychology, child and family therapy. Dr. Alexander's research and clinical work focuses on violence, victimization, human sexuality, trauma-informed and culturally informed practice. Dr. Alexander is a well-published researcher in her field, has been interviewed multiple times by media outlets, including the New York Times, USA Today, Essence, and NBC Nightly News, about her research in advocacy work. Recently, she received the 2021 Lorianne Williams Green Award for Social Justice from Division 18 and the 2022 Dr. Sarah Burgamy Citizen Psychologist Award from the Colorado Psychological Association. She is also a fellow of the Association for Prevention and Treatment of Sexual Abuse, and Dr. Alexander enjoys the intersection of psychology and popular culture, as previously contributed to the Black Panther Psychology Hidden Kingdoms. So Dr. Alexander, it is really an honor for you to be with us today, for you to share your expertise with our VA section members in Division 18. So I'm going to hand it over to you. Thank you again for joining us today.
Yes, thank you so much for the invitation, and just glad to be in this space with my fellow Division 18 members. And folks who are not currently members, please join us in the future. So I do want to spend our time today really talking about how we can increase the field's impact on social justice and in thinking about advocacy efforts within the field of psychology. That we know that there's a lot of room in which we can expand our efforts. We know now, both nationally and globally, is the time where we definitely need to engage our field. And then also reflecting on maybe our education and training didn't adequately prepare us to do this work. So giving some examples of some of the work that myself and colleagues have done over the last few years, and leaving you with some tools and resources going forward. Obviously, professor at UNC Charlotte, and our university has both a land and labor acknowledgement statement. I think this is important to kind of go over at the beginning of any presentation that focuses on social justice and advocacy, and reflecting on the history of colonization, settler colonialism, and enslavement in our nation. Sometimes it's really difficult to go over these statements because I know for some people these statements aren't quite enough. But if we're talking about things like reconciliation, repair, healing, I do think this is the first step. But that second step that has been called out by a number of different Indigenous groups as well as other minoritized groups is action. So we can talk about our history and reflect on it, but how are we engaging in efforts that are moving the needle forward? So Indigenous communities are talking about the land back movement, that if we are sitting on stolen land, how do we repair and give that land back to Indigenous nations? So I know for each of us, depending on our different identities, where we live, where we're from, and again, we have members from across the globe here today, just reflecting especially on these last few years. For maybe our older psychologists, we could be talking about the span of your lifetime and various different social justice efforts that have been happening through the life course. But I think in recent years, as we've been having these conversations, it has been evoked by our socio-political climate, and really thinking about what's next for us as individuals. But I think we were also reflecting on what's next for us as professionals, that we're having personal emotional reactions to the events of our world. But what do we do with our own knowledge, skills, abilities, expertise in order to evoke change in our communities and across the globe? So for me, I've been doing that over the course of my early career and thinking about, are there some ways of me pivoting the work that I'm doing? Are there ways I can expand it? And where has psychology been in some of these efforts? For some folks, they've told me that this is new. Psychology wasn't always talking about social justice and advocacy, but that's not necessarily true. And if you haven't read this article that came out in 2017, I would encourage you to do so, that talked about psychology's history in public policy, advocacy, social justice movements through the history of psychology. Now, has psychology made some mistakes? Of course, and that's where we had the 2021 apology and some other things that have come out since. But we've had a history in place there, and I even reflected on my own history and systems class. We talked about Mamie and Kenneth Clark and how the Clark and Clark Doll study did have some emphasis on the Supreme Court. In my early career, we talked about how amicus briefs that were written by the APA did have a major influence on Supreme Court decision making. So for me, as I was looking through all this and thinking about what's next for me, well, I have some great examples in our history of how we can apply psychology, psychological science into informing decision makers about our work in changing our environments. So the term social justice is part of our title. It's part of this series. It's really difficult to kind of think about how we're framing social justice. Right now, particularly in our socio-political climate, the term social justice has become very divisive. I'm not quite sure why. Even for myself, I wanted to pull some various terms or definitions of social justice to really examine why it could be divisive. So social justice could mean the fair treatment and equitable status of all individuals and groups. To mean equitable access to economic, political, social rights and opportunities. And one of the definitions that I've been using a lot lately that comes from Hinowitz and colleagues, who we'll get to in just a second, broadly involves championing for basic human civil rights of all people. So if we're using this term and people are saying it's polarizing and divisive, why? Now, I'm currently taking some classes in a anti-racism and education certificate program, and one of our homework assignments was to watch this video clip on dog whistles, and that's where I was like, oh, this kind of rings true. That social justice means that we are advocating for the rights and opportunities of all people. Is that what everybody wants? And unfortunately, that might not be the case. But for us, I think in the field of psychology, framing social justice as eliminating these barriers, creating opportunities for equal access in our work is where social justice is going to lie for us. Now, wrapped into that is advocacy. And once again, that's been poorly defined. When I talk to some of my colleagues about psychologists engaging in advocacy, they say, oh, well, I don't want to go out marching in the streets. And I was like, that's not exactly what I'm asking you to do. That could be a form of advocacy, or how I would label activism. But there's multiple forms of advocacy engagement that we can do. So again, reflecting on Hinowitz's article, we can engage in public policy advocacy. So thinking about ways in which we can use psychological science to influence decision makers, people in communities, elected officials. Again, we are revisiting that term social justice and making sure we're championing for the human rights and civil rights of all people, regardless of their identity. And then professional advocacy being that blending of both. That one, we also want to engage in professional advocacy for ourselves. And we've seen that, especially with Division 18 members. Some members of Division 18 have been really involved in thinking about the rights of individuals who are incarcerated, thinking about Medicaid reimbursement, or even prescription privileges for psychologists. That's all scope of practice in professional psychology for us. Or professional psychology can center around, again, our clients, just thinking about their getting the adequate access to the services that they needed in an equitable manner. In addition to this, I also talked to individuals about client-centered advocacy. So for individuals who are in direct practice and providing assessment and treatment services to our clients, how do we engage in some areas of empowerment for our clients in their own lives? I've been reading a lot in terms of the kind of subfield or discipline of liberation psychology. And so client-centered advocacy often intersects with that. That maybe empowering our clients to engage in advocacy, we know has improved their mental health and well-being. but there have been a couple articles that individuals who have been supportive of the Black Lives Matter movement have reported better physical and mental health as they get involved in those advocacy or activism activities. And then Patrick Grzanka has talked about client-centered advocacy could also be challenging white supremacy in therapy. So if you are running a therapy group and you have an individual using racial slurs, what would it mean to actually confront that individual and talk about it in treatment and address white supremacy and have a space of anti-racism in therapy? That is client-centered advocacy as well. Then I talk about this a lot because I think this is an ethics issue, that if we go to our ethics codes, we do center the principles of beneficence and justice in our ethical principles. There is some conversation about the updates to the current ethical guidelines through APA, and that maybe social justice might need to be more explicit in our ethical guidelines. So we might see that as we're seeing the draft of the ethical guidelines coming out soon. And it's not just us, it's a lot of the helping professionals that if you look throughout all of their ethical guidelines, each of these pulled here from the United States and Canada and some other international psychological associations, they have beneficence and justice in all of their guiding principles. So for us, there honestly shouldn't be a question of how we're integrating social justice, or should we be integrating social justice in our work. It's right there in our ethical guidelines. Now we need to be thinking about how do we engage and go about that in each of our professions and roles, but it's there. So why don't people engage in advocacy? And we're going to talk about a few in a minute, but it could be institutional barriers, and we'll get to some of that in a second. But more the barriers that Hinowitz has outlined in a separate study was thinking about one, disinterest. So there are some people, whether it's students, trainees, psychologists, who have no interest in participating in any advocacy efforts. It's just not for them. It doesn't jive with kind of who they are. They might not believe there's a need for advocacy or think that's in the scope of our role in practice, or they've had a poor past experience. So I've tried to engage with policymakers before. It was horrible, nothing changed, and I don't ever want to do that again. I honestly see people in kind of the second and third buckets. So uncertainty, not having enough knowledge or not feeling persuasive enough. So I do teach a public policy and advocacy class to graduate students. I taught it in our Master's in Forensic Psych program with some students from other programs in counseling and our PsyD Psych programs at the University of Denver. And they sat in this area of, well, I don't know enough. I'm not knowledgeable enough. I just don't know how to go about this. And through that class, I have them reflect on the skills and talents that we learn as in psychology training, that we engage in public speaking, critical thinking, review of the literature and research. How can you take some of those skills and go out into the public and talk to others about some of those skills? So you do have the knowledge and you have acquired some knowledge. So really pushing back against that uncertainty. And then unawareness, so thinking about the lack of awareness of public advocacy issues. So in that same class, we open each and every class with current events. In fact, I do that in almost all of my classes that I teach, even if it's cognitive assessment. I'm sure there's something in the news about traumatic brain injury in the NFL or something that I can bring in current events. This is getting people to be aware of the issues that are affecting us locally, nationally, globally. And for my students, yeah, they're not always reading the paper, so they're not always attuned to the issues that are happening in their very own communities. So how do we build that awareness and get those skills there so we can find those opportunities to advocate? So these are three that are often outlined, and I want people to kind of reflect on what is hindering you from engaging in advocacy right now, and how do you fall into maybe one of these three bins? Then the other issue that's kind of tied to that uncertainty is advocacy training just hasn't been present. I probably heard the words advocacy and social justice kind of in my graduate training programs, but I don't think it was that explicit as maybe a competency as maybe it is now in some training programs. So you have this problem where maybe your faculty aren't having the knowledge or experience in teaching or training the next generation of psychologists on how to engage in advocacy. And then again, our students aren't getting that training. So this article, some people are saying is outdated, and I think NCSPP is working on updating this article right now to see if there has been some improvement since 2009. but I'm still talking to students and faculty across the country, and they said, yeah, we just don't have training in our curriculum at present, and we're not sure how to go about it. So this is where I want to really kind of think about some examples of those different areas of advocacy and how people can get engaged. Again, you might not fit into each and every bin neatly based off of maybe your own interest or your current role in whatever organization or private practice you're in, but I believe something will work for you. So I want you to really think, and this is the final assignment in my class, is I want you to develop an advocacy plan. After this webinar, think about ways in which you can engage in advocacy and make that commitment to it. And think about what you can do in the next few months to engage in advocacy. So the first, again, is legislative advocacy. So really thinking about how we can talk to elected officials, key stakeholders in our communities, even if we go all the way to the United Nations level, about issues that are impacting our communities and where psychology can have an intersection. So for myself, got into this in some ways deliberately, in some ways accidentally. The picture on the right is me testifying on a bill to ban conversion therapy in the state of Colorado. And that came from simply asking a colleague of mine who I had a meeting with. I said, hey, I'm having this commitment to wanting to do more in my community. What are some issues that I need to be aware of? And he simply said, you know, they're still practicing conversion therapy on kids here. And again, for those who are not aware, conversion therapy is the unfounded, unethical practice of trying to change a person's sexual orientation or gender identity. And therefore, they were trying to ban licensed mental health practitioners from practicing conversion therapy approaches on youth. And I said, I said, yeah, we spent 2 minutes on that in grad school. You don't do it. It's unethical. It's unfounded. So what can I do to help? And he said, you can come to the Capitol next week and testify. And I'm very agreeable. And so I said, okay. And I didn't even know what that meant at the time. So I had to, talk to people in community, think about what this looks like, learn about how committees are set up. And that was me a week later testifying on that bill for the very first time. And again, easy. We get 3 minutes to talk to the committee who is hearing the bill about what psychology or what the profession has to say about this particular issue. 3 minutes. So in my class, I have our students select any bill that is being run at a General Assembly or even an issue that might be happening across the globe for some of our international students. And I want them to give that 3 minutes of testimony. Again, 3 minutes seems intimidating at first, but there's a lot you can pack in and a lot of things that you can say in 3 minutes. And it's not always psychological science. It could be your lived experience. So a few students this year, they had picked bills that were centered around eating disorders, and they were coming to it with psychological science and with lived experience of a person who is in recovery from an eating disorder. So being able to kind of empower individuals to be able to get up there and take a stand. The other picture on the left, more people are becoming familiar with the Crown Act, that we know that people are discriminated based off of their hair. So individuals with their hair in braids, locks, afros, natural curls, indigenous people who wear their hair longer can be fired from their job, not hired, etc. So the state of California introduced the Crown Act to prevent anti-hair discrimination bill, and Colorado followed suit and introduced it as well. And again, that was another opportunity for me to show up not only as a professional, but as a Black woman who wears her hair in natural styles at times. And so me showing up and talking to my students about it, they're like, that's a cool opportunity. What does hair and psychology have to do with each other? And I challenged them, let's think about what I could say. There's a lot we can say about the impact of bias, discrimination on individuals. Think about youth who've had to be forced to have their hair cut in order to participate in sports and what that does to their self-esteem and their self-concept. Yes, psychology and hair can be tied together. So it was really interesting to have that dialogue with my students on why I was interested in talking about it. And I'm also in forensic psych, so I talked about the school to prison pipeline as well with that issue. Have we ever thought about psychologists becoming involved in local elected positions or appointed positions? So shortly after the protest, the George Floyd protest in 2020, Denver, Colorado had 20,000 people protesting downtown shortly after the death of George Floyd. And around that time, shortly before that, I had applied to be on the Citizen Oversight Board. This is a board that does have members of the public in the Denver metro area, and they go over policing policies in Denver, and their role is to hold the institution accountable for adhering to policy or making policy change efforts. And so I was appointed to this position by the Denver City Council, and it was a great opportunity once again to have dialogue on best practices in policing and thinking about how we can center community voice and decision-making around policing policies, as we were in a city that had lost so many, including Elijah McClain in the year in which this was all occurring. You're never too young to become an advocate. And again, when my students are often wary about not being knowledgeable enough or being informed, I often have to remind them that if we look at any type of social justice effort across the globe, students were often involved. So a lot of if we look at the civil rights movement in the South, there were student groups that came together and were involved in advocacy. I've traveled to Prague, and they talked about the college students there engaging in different areas of advocacy. So you're never too young. I forced them to actually go to the Capitol. In Denver, we had the luxury of having the Capitol building about 10 miles from campus. So they had to go to the Capitol building for a tour and listen to the hearings and again, engage in that legislative advocacy. And afterward, they said, yeah, how can we engage in advocacy efforts on our campus? So a few of my students who took the class and wanted to do more, they developed a newsletter called The Advocate that they published every month, talking about opportunities for advocacy in our community. We had murals in our front office kind of area, our entry area of our building, where we had our psychology programs, one for Pride, one for Black Lives Matter. So our students thinking about ways and opportunities that they can get involved in advocacy. Thinking about their own histories, that now individuals in middle school and high school have already engaged in various types of advocacy already, and so being able to give them a platform in our institutions. Then as I was reflecting on Division 18, I think for the folks here, there are so many opportunities to engage in systems level advocacy. Yes, you might be working in systems that have a lot of rules and regulations and are governed by various government statutes and things like that. But are there some areas of advocacy you can engage internally? That many of you hold leadership roles and positions. And so I often ask people, name one thing you would like to change within the system now. It should be easy for you. I hear you complain at the water cooler all the time. So how do we dig in and make that change? Myself and a theater colleague at University of Denver, we founded the Denver Prison Arts Initiative. How can we bring creative and therapeutic arts into prison facilities throughout the state of Colorado? Again, some of this could be a form of repair and healing. This also could be a form of transformative justice and accountability. It often was changing the minds of people who were working in the prisons and how they saw individuals who were incarcerated, and also those on the outside. So thinking about those opportunities to create programs that can change the lives of the people who are in these systems and maybe go beyond that. Worked in spaces where we've talked about the competency crisis that's happening in forensic mental health systems throughout the country. My former colleague, Dr. Neil Goensmith, does a lot of advocacy on this, not only in the US, but also in South Africa. Just thinking about how we can come together, and we'll talk about the importance of interprofessional advocacy to resolve some of the crises that are happening and again, improve the condition of individuals who are in these systems, that these wait lists are too long, people are deteriorating. So can we come up together as professionals with some clear guidance for states and for legislators on how to resolve this issue? Because we can do some of it. So one of the solutions that Neil Goensmith and I followed suit with some of his work was creating outpatient competency restoration programs. That not everybody needs to be in a state hospital or a jail system in order to be rehabilitated and be deemed competent again. So that was something where people come together and kind of think of creative solutions to change systems. And then I just got a Q&A question, and it leads into some of this. let's think about the cross-section of research and advocacy. So one, I think the public has been challenging us for quite a while on how they don't often reap the benefits of our research, at least directly. That we ask people to participate in our studies and maybe don't give them the results back, especially with maybe some forms of community engaged scholarship. We use federal or state dollars to engage in our research and people don't get access to it. You try to look up my journal article and you're hit with a $50, $60 fee because it's behind a paywall, so you never get to read it. So the public has been challenging us for a while on how are we making research more accessible. We're having trouble with a lot of our different studies right now in psychology where people aren't wanting to participate because one, maybe we're not incentivizing enough for them to participate and give their time and give their own personal narratives. And then two, they don't get to see the results anyway. So what's the point? So I've been thinking about this quite a bit lately, and this is where the term public impact scholarship comes in. Let's think about different ways to get our scholarship, our knowledge, our research out in ways that are beyond a peer-reviewed journal article that just a few other researchers are going to read. Maybe a few hundred researchers if it's cited heavily, but the public still doesn't get access to it. So are there other ways that we can get the public access to our work, whether that's creating blogs, tweeting your work on Twitter? No Twitter's divisive right now, but again, that being an opportunity to get scholarship out there. Doing podcasts, webinars, op-eds, public reports, TED Talks, YouTube videos. All of this can expand our reach and our impact into communities. I've known colleagues like Dr. Lindsay Malloy, Dr. Kim Gorgans, who have over 2 or 3 million views of their TED Talks. So their TED Talks are often about their research. And again, their research probably gets read by most of us and we might cite it, but how did their research get out to the public? It might have been a little hindered until that TED Talk, 10 minutes, it gets out to millions of people, and now they're acquiring the knowledge of their TED Talks. So really being deliberate in thinking about what are the mechanisms you're getting your scholarship out to the public. I want us all to be thinking about this. In fact, for master's theses and doctoral dissertations, I'm challenging students to have like a public impact, either statement or piece that they're going to do that aligns with their dissertation or thesis. So one student right now, she's doing a policy analysis for her dissertation. So got that all tidied. And then she got an op-ed published based off of that policy analysis a few weeks ago. So great example on how we can tie that in together. And again, I had the luxury when I was at University of Denver, we had a public impact fellowship program that got faculty from across the university, different disciplines together to give us a little bit more training in how to do this. How do we write op-eds for the papers? How do we engage in media interviews when there's a pressing topic in the news that might be relevant to your area of research? So the news clip at the bottom and the op-ed at the bottom had to do with a local girl who was in the trial process for murdering her nephew. So we were having conversations on should youth be tried as adults. And so again, giving an opportunity to have the discussion on what our research is currently saying and engaging in some form of media advocacy. Top one up front was an op-ed. We had the governor of Colorado come to our university, I think just days after the STEM school shooting. And they asked them, this is another school shooting that's happened in Colorado. What are we going to do about it? And they said, I'm going to increase school resource officers. And I said, that's not going to be the cure-all. So I went home, wrote this op-ed. You see it was published the following morning, I think. And I said, we have to think carefully that we have had school resource officers present during some of these incidents. And again, that might not be the only mechanism of prevention. So can we have some conversation about evidence-based approaches to preventing school shootings? So really thinking about those opportunities that we can engage with not only the public, but also elected officials in some of these efforts. Again, thinking about your areas of research and how can you expand that there. So during COVID-19, my research team kind of came to a halt because we had COVID. We had, again, the racial reckoning with the protests. And we said, we need to think about all these current socio-political issues in our climate and how that's intersecting with our work in psychology. So some of my students were engaging in practicums at our local jails and prisons. And we said, what's happening to folks in terms of COVID-19 in jails and prisons? You can't socially distance there. PPE was limited at the beginning. So in order to reduce the spread of COVID in jails and prisons, do we need to be thinking about decarceration? Could some people be released from jails and prisons who are safer, low risk, individuals who are older, individuals with medical conditions? What would that look like, not only to have some advocacy and justice for those individuals, but also to reduce the spread of COVID? So we wrote this editorial in the Journal of Humanistic Psychology, really outlining that, that there has been this field of smart decarceration that has been transdisciplinary to think about individuals who do qualify for compassionate release, or other forms of release options in jails and prison settings. California was really successful in that they were practicing decarceration. And again, it helped to reduce the spread of COVID without risk to public safety. We were having these conversations at the time, and the governor of Colorado came out and said, yeah, I'm not letting violent people out of prison. And we said, once again, you didn't quite get it. We're not necessarily asking for violent people to be released from prison. We want to release people in a safe and, again, way that's informed by the evidence. So again, that was another opportunity for an op-ed in that situation. And again, our research team was just watching, again, many people in my research team had took my advocacy class, and we were watching things that were happening around us. So we heard about the death of Botham Jean, and were really kind of moved by that, and how his death could have been preventable, and how in his particular case, the issue of stand your ground laws were coming up. For those who don't remember, he was shot in his own home while eating ice cream by an off-duty police officer. And we were just going into detail more about what are these stand your ground laws? What are Castle Doctrine laws? How are they being applied? Are they being applied inequitably? So a student of mine, Emma Sower, had come up with a research project centered around this case and the conversations we were having. That we took some vignettes and altered the person's gender and male or female, and how they were assigned to the cases, Stand Your Ground versus Castle Doctrine, to get a sense of kind of public perception and public opinion about these different types of cases. So we worked on that with, again, Botham Jean in mind, got it published a few weeks ago. And right after we got it published, again, we had the case of Ralph Yarl, again, that 14-year-old who knocked on a neighbor's door and was shot. So again, it reflected on the timeliness of our work, and we wanted to continue this work anyway. And so we're doing some replication studies, again, based off of youth who have recently experienced these tragic incidents and shootings, and thinking about how Castle Doctrine and Stand Your Ground laws are being inadequately applied to some of these cases. So, that's just the start of really kind of thinking and brainstorming some ideas of how you can engage in different areas of advocacy with, some examples from my own career in these last 3 years of how I've been engaging in this work. An hour is just not enough for us. So wanting you to make sure that you have access to resources to follow up on some of this. One, please engage with APA's advocacy office if you haven't already. Please browse their site. Again, a lot of the different areas on their site, areas of specialty, do intersect quite well with Division 18 and some of their efforts. They have action alerts on there, so if you're not already getting them, please make sure you sign up for that. If they need to have an email blast to senators about an issue of like student loan repayments is the big one that I always fill out. They give you the sample letter, and you can just copy paste and send it to your senator. If you want to put your own personal narrative, you can, or you can just do the copy paste and send it off. So please continue to engage with them. They have a lot of great resources and people who are working with their office. So they're great. They have a psychologist guide to advocacy. My students always get chewed out when I bring legislators to campus because they don't know who their local senator and representative are, and they definitely don't know who their national one is. So even things like that, making sure you're learning the landscape of who represents you, both in your local community, your national community, who you're voting for, et cetera, is really important. So there's some tools to do that there. APA has some policy fellowships. Again, I've heard them spoken highly of. It's my goal to do one of them in a couple years. So again, some opportunities at the federal level to become involved and have a voice and be a representative and ambassador of psychology. The applications always are due around January. So thinking about, is that an opportunity to expand your wealth of knowledge in federal advocacy in the future? For individuals who are engaged in the education and training of students and trainees, the Council of Chairs and Training Councils developed this toolkit that is really great. They got together for, I think, about 3 years to develop this toolkit to look at the different, how they were looking at the different areas of competency within advocacy and social justice efforts. Think about the milestones at each level of education and training for students. And really be a great guide to thinking about how we want to start structuring our programs. So some might be aspirational, some things you might be doing well, but it's another resource out there that is really great, that was created by some other colleagues of mine. And then finally, a big task force, and I think a few different divisions were represented, including some members from 18 on this. It's another community advocacy toolkit. It starts you off with some of the basics of how to write a letter to a representative and how to kind of structure it, and gives you some guides there, how to engage with media. So again, another resource where you're not starting from scratch that, again, fellow psychologists have developed that is out there for your use. So another good resource. So I want to end before we take some more questions with just challenges and future directions. It's getting increasingly hard to do this presentation. I do various forms of this presentation for different programs and student groups and this, that, and the other. But I have to acknowledge the realities that we're facing with institutional barriers that are coming up for folks. So we know there's institutional barriers. We know for individuals who are federal employees, there are limits on the type of advocacy you can engage in, and particularly the type of advocacy you can engage in at work. So we have to be careful with that, make sure we're not violating any rules of your institution, making sure that you are clearly advocating off time, that you're not representing yourself on behalf of the institution that you're working for, just being very clear of that. Even when I do legislative advocacy, university when I introduced myself, because I had fear. Again, I think we had some protections, but you just didn't know. So being clear that you were off time and not representing the organization being important. Your institutional climate. So you might have individuals who are really wanting to engage in these advocacy and social justice efforts, and others who are just not on board yet. So that dynamic can be really tricky. And kind of my final words of wisdom is we're going to need some transformative leadership to amplify some of the work that I'm encouraging right now. We have the ongoing legislative changes and challenges, and that's the pictures that you see here, that if we're having trouble even saying the term social justice or diversity, equity, inclusion, we're going to have some problems. So this is my biggest concern in this moment of what are we actually going to be able to legally do in some of this work. And again, maybe this is another call to action for psychologists to step up and talk about the harms that these types of bills are causing. And with that, if we're talking about being an advocate or being an ally, there are risks. So for you all to be thinking about what are the risks that you are willing to take to engage in this work. And I can't identify that risk for you. That's personal to you. You might have a family, people you take care of, so some of your risk might be a little bit more heightened. But there's always risk in allyship, and I think it's important for us to reflect on that and reflect on our areas of privilege in our identities, when we're thinking about engaging in this work. So for my future directions is, we have to intentionally think about how we're integrating advocacy, activism, allyship, and social justice into our work. Again, we have a number of different people who are attending right now from a number of different fields and subdisciplines of psychology, from students to trainees to psychologists from all different levels, from early career to senior career level. What are you doing right now to actively, deliberately, intentionally engage in advocacy and social justice? What are some things that you can improve upon? So again, thinking about that advocacy plan for yourself. There are so many different spaces that we could jump in, and so thinking about what that looks like. I often say advocacy isn't a solo sport. That means a number of different things. That means, one, I couldn't do any of that advocacy without having connections and relationships to other people in community. And that's going to be people outside of professional careers. That's people who are just day-to-day public members. So one, we have to think about that in our relationships to community. So I want you to think about, are you aware of the current social issues in your community? Are you showing up to city council meetings and listening? Are you picking up the newspaper and just reviewing it? What is your community currently saying about climate change? So find those opportunities to engage in community forums, meet others is really key and important. And then once we get to the professional area, we do need to think about interprofessional advocacy. Again, thinking about all the different places that Division 18 members work in, you're probably working in multidisciplinary departments and units. You're working with nursing, you're working with psychiatry, you're working with corrections, you're working with police. So how do we come together to collaboratively engage in advocacy efforts is something we need to be thinking about. We're often too siloed, and we need to break down those silos. And then finally, I alluded to this just a few minutes ago, is we need transformative leadership. Again, the name of the series is Psychologists as Change Agents. And so we need individuals who are willing to engage in brave spaces and willing to take on transformative leadership to engage in these efforts. Or else we're going to hit those walls in terms of institutional, maybe policy or institutional climate in engaging in advocacy efforts. So for those who are in leadership positions or might be, so if I'm talking to students and trainees, you're going to be in leadership positions before you even know it. What do you want to model as a leader? Again, I tell them to think about all the things you complained about in grad school, and don't do that when you become a professor. Don't do that when you become a supervisor. What does that actually mean when you do step into the position of leader? And so to engage in any type of change, we need to have those transformative leaders at our organizations, in our communities, et cetera. So for all of you at Division 18, I need you all to show up as those transformative leaders. So once again, I want to thank Division 18, the VA section, the diversity section, Marie, all of you for inviting me to this. I think it's so great that Division 18 is hosting this series because, again, I think that's a commitment to this work and transformation. So we do have a few minutes here. Again, if there are some quick questions, please put them in the Q&A. If you aren't comfortable putting them in the Q&A, I do take emails, so you have my email address and things like that, and I can try to connect with you.
Thank you. Thank you, Dr. Alexander. Already receiving a lot of kudos for that inspiring presentation. I'm going to try to get you through some questions here. So the first question we have is from Catherine. She asks, what advice do you have for early career psychologists looking to become transformative leaders, particularly in large organizations like the VA?
Yeah, I think some of this is also thinking about mentorship. So the VA is a big connection, and you have some great individuals, some who are in Division 18 who have been leaders of different VA systems. So I think about Dr. Lynn, who is part of the VA. That's kind of my go-to, and thinking about some of this work and somebody who's showing up. And then also you reflecting on what can you accomplish in those type of systems. I know there's barriers. My parents are veterans. My dad's somewhere around in the back, probably listening. I know there's barriers in these systems, and so thinking about for VAs, I always go to maybe some of that client level advocacy work. that we're all committed to making sure that our veterans have equitable access. And so maybe that's the space of advocacy you can engage in when institution is creating some of those barriers.
Absolutely. And I can imagine what an important question, because when you work for such a large system like the VA, it could feel like change. When does it happen? How do you steer such a large ship? So I really appreciate that comment there on incremental change and leaning onto those mentors. Marie asks, given the political climate and the risk involved in advocacy, what are your recommendations for self-care? How do you keep the work going?
I love how I accidentally always skip that question because it always comes up. And I see it in the chat too, in a different way of what are your thoughts on racial battle fatigue or how minoritized groups stand up for justice and feel fatigue? Again, that's my number one question because I miss it in the presentation. Usually because of that block, that we often have to be aware of the wear and tear that happens, the weathering that happens for individuals who engage in this work. We lose individuals, whether that is by death because of health problems that come with engaging in this type of advocacy and racial battle fatigue, or they just don't want to be advocates anymore because it is a lot. So part of this is really thinking about what is your self-care plan as you engage in this. That goes back to my advocacy isn't a solo sport. So I have all sorts of accountability partners who are making sure that each other were engaging in self-care. So I had friends who would just text me once a day during the protest, have you drank water today? Have you had a vegetable? So I had salads mailed to my house. So we need to make sure that we're taking care of one another and protecting one another in this. And there was a little bit that I alluded to as well is when we're talking about minoritized groups engaging in this, this is where we need allies to stand up. So again, thinking about your own identity and your own privileged identities, we need allies to show up and take on some of this work. So thinking about those things of, oh, can you send me a reading list or something to read on this book? No, you can look it up too. So you can do the work. These resources have been here for decades, maybe even centuries. Sometimes in my presentations, I have a screenshot of the New York Times bestsellers list from like June or July of 2020. And it was How to Be Anti-Racist, White Fragility, all of these books that actually had been out for years. Mm-hmm. Yes, people were picking them up now, and I say, yeah, better late than never. But again, it kind of speaks to what are you consuming? Why is this the first time that you're reading about redlining and gentrification during this crisis? So needing allies kind of step up is part of the self-care work as well.
Absolutely. We were at the Psychology Leadership Conference this weekend, and someone did mention that, Dr. Alexander, that allyship is something that is earned, right? That you have to demonstrate to the groups that you are an ally to really be able to see how you're taking that agency and responsibility, and that helps with the fatigue as well. So point well taken. And Thoraya, I know you kind of talked about this earlier, but Thoraya also had a question about what are your thoughts about engaging in media op-eds as advocacy, and how would you best approach using those and leveraging those as tools?
Yeah, I think it's a great opportunity. I didn't say it in the resources, but the op-ed project also has a lot of resources on their website, and you can also invite them out to trainings if you have a budget for different organizations. But yeah, that's another opportunity for folks as they're staying in touch with the news cycle. How can I jump in right away and write an op-ed? It's 500 to 750 words. I know a lot of our researchers write way more than that, so very easy to engage individuals in extending the conversation. There might be a media story that doesn't have the full picture or the psychological expertise or science to it, and that's where you can add and contribute to that. So on social media, I'm very active on Twitter, as people know, and Instagram. I follow a lot of the different journalists in my community, what they're writing about, what they know. So, and also as I'm posting my research, they get to know me. So the journalist who's on the crime beat is going to reach out to me when there is a school shooting, a hate crime, whatever, because of my intersection with the legal system and forensic psychology. So building those connections is really helpful because you're going to be the go-to source.
Right. And what a great plug for our next webinar here in July, which I'll give folks a little bit of information about, because you mentioned engaging with APA Advocacy's office. There's a lot of great resource out there. We actually are going to have APA's Advocacy Office present in July for those of you that are interested. And the title of that presentation is Positioning Yourself as a Subject Matter Expert for those that might be doing this work as well. I am mindful of the time, Dr. Alexander. I selfishly want to keep this conversation going for several hours, as people in the chat have already also alluded to in their appreciation. I was actually joking with Jeremy in the background that I want to audit your graduate class because I've learned so much, and it left me with a lot of questions in terms of how can I become more intentional, and really just kind of seeing you go through the presentation of every step of the way, making sure that you're asking yourself these questions is I think really important to make sure that this work is impactful and sustainable. So again, thank you for your time and your expertise. I'm going to steal the last couple of minutes here just to do some last minute announcements. For those of you that are interested in joining us next month, we do have a little bit of a double feature. We have a webinar presentation coming up on July 3rd. So I know it's a little bit on the heels of the holiday week for a lot of people, but I would encourage you to join us for interventions in psychosis across diverse populations. And then we're going to have the last installment of our advocacy series presentation a couple of weeks after that on July 14th. So that's where Ms. Conwell Smith from our APA Advocacy Office is going to talk to us about positioning yourself as a key resource for partners in advocacy. And then we will also have a series of presentations that we have lined up for you in the fall. So we'll give you all some information about those as well. Being mindful of the time, again, thank you all for joining us, Dr. Alexander. It's again an honor and a pleasure to be able to have you with us. Definitely, very impactful for you to be able to share with us your expertise, and look forward to seeing everybody again in our future webinars.
Thank you.